Kids have no voice with the legislature. They don't get to make decisions about Medicaid and the way medical homes are set up. We have to do that for them. And it is a fight a lot of the times to try to get them to see their pediatrician. So Texas unfortunately leads the nation in uninsured children. Out of all 50 states, we have the highest percentage of kids who don't have access to care, don't have any health insurance. We're currently at 1.5 million children, or 22%, twice the national average, and many of these kids are actually eligible for Medicaid, 700,000 or 500,000 depending on who you talk to. Uninsured children have a lot of health problems. There has been many studies that have shown that they're, less likely to have all their immunizations. They're more likely to have problems with recurrent infections. So not only are they having problems focusing in school because of their oral health, but because of their sore throats, their ear infections, other things that they don't get care. They have more school absences, and therefore their parents can't go to work, and so it's actually all around bad for the family. And they're more likely to use emergency rooms for their routine care and get hospitalized for things that could have been prevented, which ends up costing us as a community more money in the long run.
Health is really one of the most important things in regards to children's development that we can talk about. And when we talk about health, we're talking about CHIP and Medicaid for children. It's so important that children and their families have access to health coverage, to medical homes, and we really want to make sure in the state of Texas that every single child has access to that medical care. One of the real important things that we can do in the state of Texas around this is have community health workers. Community health workers are able to go in the homes, work with parents. They're able to provide families with real access to medical care and an understanding of what needs to happen around medical care. And when you have a state like ours with a very diverse population, especially one with such a large Latino population, a medical and community health worker can really be really invaluable in making sure that the community understands where to go in regards to medical care.
Community health workers it's a very broad field, really just kind of linking people between resources and their needs. Community health workers, I think, are really effective because they mirror the community that they work with. They look like their community. Many of them are from that community, so they have firsthand experience dealing with a lot of the problems that the community itself is dealing with.